Hello, welcome to sonography-radiology training channel. This series of videos is about basic radiology learning of chest imaging. This is the second video in this video series with title of A Technically Adequate Chest Radiograph Part 2. These items was explained in video part 1. In this video part 2, I will explain magnification, angulation, and final teaching points. At first, magnification. Magnification usually is not an issue in assessing normal pulmonary anatomy, but depending on the position of the patient means posterior, anteroposterior, or portable anteroposterior position relative to the imaging cassette, magnification can play a role in assessing the size of the heart. In the standard PA chest radiograph that is obtained in the posterior anterior projection, the heart being an anterior structure and is closer to the imaging surface, and thus truer to its actual size. Of course, in a PA study, the X-ray beam enters at posterior and exits at anterior. The standard frontal chest radiograph is usually a PA exposure. On the AP image, that is one obtained in the anteroposterior projection, the heart is farther from the imaging cassette and is therefore slightly magnified. Another one, in an AP study, the X-ray beam enters at anterior and exits at posterior. Portable B-side chest radiographs are almost always anteroposterior. Here we can learn an important radiologic rule. The closer any object to the surface on which it's being imaged, the more true to its actual size the resultant object will be. As a corollary, the farther any object from the surface on which it's being imaged, the more magnified that the object will appear. Here we can see the effect of positioning on magnification of the heart. This frontal chest radiograph done in the AP projection shows heart to be slightly larger than image B, which is the same patient's chest exposed minutes later in the PA projection. In actual practice, there is very little difference in the heart size between an AP and PA exposure so long as the patient has taken an equal inspiration in both images. Another reason the heart looks larger on portable AP chest image than a standard PA chest radiograph is that the distance between the X-ray tube and the patient is shorter when a portable AP image is obtained, and it's about 40 inches. So this distance is shorter when we take a standard PA chest radiograph, which the patient is exposed at about 72 inches or about 180 centimeters. Here we can learn another important radiologic rule. The greater the distance the X-ray source is from the patient, the less the amount of magnification. Angulation. Normally, the X-ray beam passes horizontally parallel to the floor for an upright chest study, and in that position, the plane of the thorax is perpendicular to the X-ray beam. As we can see in this image, the X-ray beam is correctly oriented perpendicular to the plane of the cassette. Here, the orange square symbolizes an anterior structure like the clavicles, and the black circle is a posterior structure like spine. As we can see here in a standard PA chest radiograph, the clavicles is lower than the first thoracic spine. If the patient is sitting or standing upright and the X-ray beam is angled upward, the image so obtained is called an apical lordotic view of the chest. As we can see here, the X-ray beam is no longer perpendicular to the cassette, which has the effect of projecting anterior structures like clavicles higher on the radiograph than the posterior structures like spine. If, on the other hand, hand, the X-ray beam is horizontal, but the patient is tilted backward. This produces the same apical lordotic effect. As we can see here, this leads to exact same result as apical lordotic view and is how semi-recumbent beside AP studies in hospitalized patients are frequently obtained on patients who are not able to sit or stand upright. Another one, anterior structures like clavicles higher than posterior structures like spine. As I explained, on apical lordotic views, anterior structures in the chest like clavicles are projected higher on the resultant radiographic image than posterior structures in the chest like spine, which are projected lower. What is the pitfall of excessive angulation? An apical lordotic view distorts the appearance of the clavicles and straightening their normal S-shaped appearance. The lordotic view also distorts the shape of the heart and produces spurious obstruction of the left hemidiaphragm. To avoid this pitfall, know how to recognize technical artifacts and understand how they can distort normal anatomy. If you have any problem, consult with a radiologist about confusing images. Now, please pay attention to the final teaching points of these two videos. 5 parameters define an adequate chest examination, and recognition of them is important to accurately differentiate between abnormalities from technically produced artifacts. They are penetration, inspiration, rotation, magnification, and angulation. If the chest is adequately penetrated, you should be able to see spine through the heart. Under-penetrated or too light studies obscure the left lung base and tend to spuriously accentuate the lung markings. Over-penetrated studies means too dark images may mimic emphysema or pneumothorax. If the patient has taken an adequate inspiration, you should see at least 8 to 9 posterior ribs above the diaphragm. Poor inspiratory efforts may mimic basilar lung disease and may make the heart appear larger. The spinous process should fall equidistant between the medial ends of the clavicles to indicate the patient is not rotated. Rotation can introduce numerous artifactual anomalies affecting the contour of the heart and the appearance of the hila and diaphragm. Anteroposterior films, mostly portable chest X-rays, will magnify the heart slightly compared with the standard posterior anterior chest radiograph, which usually done in the radiology department. Frontal views of the chest obtained with the patient semi-upright in bed or tilt backward may produce apical lordotic images that distort normal anatomy. Now, I suggest 2 others of my videos that are close to this video in terms of matter. And thank you for your attention.